Hi. Thank you for coming and listening to me talk about patient-centered care. I appreciate this and am glad that you're interested in improving your patient's wellness journey. Well, you can see from this picture, this is the essence of patient-centered care. You can see my grandson Elijah is very comfortable. He's engaged and he's involved. And if we have that, or if you already have that with your patients, you really don't need to listen to the rest of this talk. Well, I'm glad that you stayed and want to hear more about patient-centered care. There's lots of information available on patient-centered care. ShareSpan, Pickler Institute are just a few, and I'll be mentioning them as we go along. So let's just stop here. And I just want you to think about what you think patient-centered care is. Really get an idea of what you do in your practice currently to promote patient-centered care. Well, patient-centered care is a healthcare model that prioritizes patients' unique needs and values and preferences. It emphasizes listening to patients, educating them on their conditions, providing emotional support, creating a compassionate environment, and especially actively involving them in their care. This model really empowers your patients to collaborate with you, to share in the decision-making process, and to pursue the outcomes that are personalized to their long-term goals. It also highlights the importance of enlisting the supports of family members, friends, and the community in their care. It really shifts the focus from patient-specific medical conditions to a more comprehensive, holistic view focused on physical comfort, mental health well-being, and their individualized goals. So the British research firm Pickler Institute established 8 principles of patient-centered care. And we're going to briefly cover those today. As importantly, the first one is, again, respect for the patient's values, preferences, and needs. This really should guide your decisions. They should be partners in your wellness, in their wellness plan. We really want to avoid disjointed, disruptive care delivery. We want to facilitate effective communication across the patient's care continuum. We need to ensure that all aspects of their care is considered. Importantly, it's clear communication is vital. We want to make sure that the conditions are there to proactively have the patient participate with us in their healthcare journey by providing clear communication about the plans, their labs, and their overall health. It's important to pay attention to environmental needs and physical comfort. We should provide a safe, comfortable environment and address their physical comfort and pain management. I think we all recognize the importance that recognize the emotional impact disease has on patients. The other one way to address this is to use sensitivity, empathy, and reassurance. The involvement of the patient circle of loved ones should be encouraged. We should empower the patient's family and friends to support them in their wellness journey. We want to reduce readmissions by emphasizing seamless transitions. We want to ensure that the patient is confident and comfortable in the ability to take care of themselves after discharge. We also want to get the right services for them at the right time. This might mean getting the availability of appointments, specialists, and ambulatory care. We really want to minimize wait times for referrals, treatment, and scheduling. Another way to think about this is, I think we all do an incredible job when we start seeing a patient for a first time. We typically ask open-ended questions, and then we quickly move to what is the diagnosis and what is the next step I need to do, without really listening to what they are saying, what their goals are, what their belief about the medical condition is. And that's incredibly important. I know I'm saying the same things over and over again, but they really do say, in order for something to sink in, you really want to hear it 3 times in 3 different ways. So that's what I'm also trying to do today. I like what Walt Disney said. And so we're going to talk a little bit about some specific things that we can do. So patient-centered care really hinges on treatment plans, and treatment plans that are tailored to the needs and preferences of patients. The wellness journey is influenced by their cultural background, personal values, and socioeconomic conditions. You need to integrate this into their wellness plan. For example, a patient with a cultural background that emphasizes natural remedies may have a preference for traditional medicine for their chronic conditions. You can honor this by encouraging the use of safe and reliable natural remedies alongside conventional interventions. Patients are really much more inclined to follow your treatment plan if they're individualized to their needs and their worldview. We really want to encourage shared decision-making and giving them the agency to ensure that all their treatment plan is evidence-based and effective. In patient-centered care model, all decisions are guided by the patient. When the patient feels listened to and respected, they're much more likely to trust their physician's recommendations and take responsibility for their journey. Patients who are actively engaged in their journey are much more likely to adhere to their plans, advocate for their needs, and take preventative and proactive measures for their health. It goes without saying that compassionate, active listening is a core feature of patient-centered care. You really want to engage them in ongoing decision-making process. Really dedicate yourself to building relationships with the patient. For example, understanding a patient's family dynamics will help provide you with knowing the important family members you have to bring in for certain conversations about treatment. Discussing their fears and traumas can help us improve the physical and mental health of our patients too. Another core tenet is providing emotional support. Studies over and over demonstrate the link between emotional and social support and improved clinical outcomes. Patients with strong support systems have less episodes of anxiety and depression, which can adversely affect treatment compliance and make them more willing to engage in the necessary lifestyle changes. Importantly, gaps in coordination can be detrimental to patients on their progress, their morale, and their healthcare cost. Consequences of poor care include overprescription of medications, duplicated tests and screenings, and unnecessary hospitalizations. Alarmingly, patients with multiple chronic conditions are more likely to receive poor care coordination. And this is due to the complexity of their illness. So now that we've heard just a brief bit about patient-centered care, I want you to think about one thing that you could do tomorrow to make you or your organization more patient-centered. I really do wish I could follow up with an email or a text in a month or two to see how successful you were, but I'm very excited that you're even thinking of trying. So congratulations to you. Thank you.